So today we're talking about injuries to children that are caused during pregnancy or during birth.
Yeah, people say birth injury, but they're really talking about injuries that have occurred sometime between conception and delivery.
It's a very good point, because of course many parents who come to us are very concerned about what will happen when they're no longer around.
Don't let the fact that more than 3 years have passed put you off. In fact, don't let the fact that your child's over 21, for that matter, put you off.
One thing that people have worried about is whether or not the money will run out. Hello, and welcome to today's episode of Medical Negligence Matters. Today we're going to be talking about injuries to children caused during birth. And with me today is Tami Frankel, my colleague and good friend. Welcome, Tami.
Thank you.
So today we're talking about injuries to children that are caused during pregnancy or during birth. It can be quite a complicated thing, isn't it? Being born is quite a complicated process, and there's lots of potential dangers along the way. Obviously, we see sometimes cases that involve not necessarily the birth itself, but things that have happened or gone wrong during the process of the pregnancy.
People say birth injury, but they're really talking about injuries that have occurred sometime between conception and delivery. And sometimes you don't know exactly when the injury occurred, and sometimes somebody hasn't caused the injury, but what's happened is all that antenatal monitoring is supposed to catch something which is happening and do something about it. And it's a failure, which then allows whatever that injury or insufficiency is to continue. And it's only noted when the baby is delivered, which I think is why everyone says birth injury, meaning the whole gamut of injuries that a baby can suffer and which are noted upon birth.
That's right. I mean, one of the things that I think we've seen fairly frequently is things like intrauterine growth retardation, isn't it? Where, sometimes it can be because the placenta isn't working effectively, and it means the baby isn't getting the nourishment, and so the growth is not as it should be. And of course, that's the thing that should be picked up on regular antenatal visits.
It's one of the whole reasons for antenatal care.
And so if we have had cases where that has been occurring, it hasn't been picked up. But of course, if it had been, then maybe the baby could have been delivered before harm could have been suffered. And also the scans that are performed during pregnancy, of course, are designed to pick up things like anomalies, problems with the heart. Of course, not everything is detectable in advance. I mean, even with modern day scanning, I think any obstetrician will say there's no guarantee. But there are some things that can and should be picked up.
Yeah, and the benefit there is that you can't always change whatever it is that's been picked up, but you can plan for it on delivery. You can plan for the baby to be delivered at a specific time in a specific place with a specific team around who can do whatever might need doing, such as surgery, in order to deal with it really promptly and save that baby from having difficulties or worse difficulties through their life. Yeah.
And the birth process itself, obviously can be quite tough on both mother and baby. And we've talked in previous episodes about the problems that some mothers can suffer as a result of the process. But obviously the baby is in a very vulnerable position and can, although they're tough little creatures, most babies, but they can be quite seriously injured if the delivery isn't managed appropriately. What sort of situations have you come across in the cases that you've dealt with?
Well, just about all birth injuries are as a result of somehow a stopping of oxygen for a period of time, whether it's a slowing of it for a long period of time, maybe a partial occlusion or something, so not enough oxygen's getting through, or completely stopping the oxygen because the baby's stuck in a vulnerable position. And often you couldn't have changed that, but something should have been done differently so it didn't occur. Or once it occurs, there are specific manoeuvres which should be carried out, but the team don't recognise it and don't do anything quickly enough. Or it might be that through the monitoring during the labour, a baby's getting into difficulties. The whole purpose of monitoring during labour is to see if the baby's getting into difficulties, and if it appears to be getting into difficulties, to do something to help it, because what you want to do is stop it from being starved of oxygen. And that's, I mean, I think that's almost all cases, really. I suppose the only other real example of things like Herb's palsy, when has been a delivery that's left another sort of injury.
Yes, I think that's right. And that's the sort of injury where pressure on the baby's shoulders and neck caused by trying to extract them can cause injury to the nerves in the brachial plexus, which can then affect the arm. And that is something that we see, sadly, quite frequently.
More often than you should.
And there is controversy over it, isn't there? Because some doctors will say that the natural forces of labour can be responsible for the injury, but not in all circumstances. And sometimes there will be very clear evidence that excessive force has been used on pulling on the baby's head in order to get them out, which has caused damage to the nerves in the shoulders. But that sort of injury, of course, can be very
it can be really
affecting.
debilitating, especially if it's the baby's dominant hand or something which has been affected. You've effectively left a child from birth with one useful arm, and it's not even the one that would naturally be dominant for them. Yes.
So those claims can actually result in quite significant amounts of compensation because you have a lot to make up for. But of course, the cases that I guess make the headlines and the ones that actually result in the very enormous damages awards are those where, as you say, the lack of oxygen to the baby's brain during the birth process results in permanent injury, which, there can be degrees, can't they, of difficulty caused by that. I mean, in some cases, the injury is so profound that, in fact, the mental functioning of the brain can be relatively well preserved, but the physical control of the body is almost gone. And those can be some of the most tragic cases. I mean, in other cases, you see a sort of a broad damage.
You can see global developmental delay, physical and mental. Or you can have children who are born and they've maybe just got milder cerebral palsy, so they've got difficulty with some areas of mobility. They can still be mobile, but it's clear that they're not walking normally. And yes, the whole range of it. And what you look at is what level of disability have they got and what will they need to help them compensate them for that. And that's what makes up their award.
It's tricky, isn't it? Because I think a lot of parents are, a lot of doctors understandably are quite reluctant to give parents a prognosis or to put a label on the injury. And we see this quite frequently, don't we? And it can be quite troubling for parents. But I can understand that so little is known about how the human brain develops and how resilient it is, that it can be very difficult for a doctor at the outset to give a very firm prognosis about what the future is likely to hold for.
Well, I think they mostly say the child needs to reach about the age of 8 before they can give you a realistic type of prognosis for how the child is likely to develop. And, of course, life expectancy, because life expectancy is a big determinant of the size of compensation that you're going to get, the amount that you're going to get.
And I suppose the label cerebral palsy is a sort of an umbrella term, isn't it? I mean, it is the dysfunction of the muscles that's caused by lack of oxygen to the brain and the disruption of the signals from the brain to the muscles. But it covers a very broad spectrum of injury, from the very mild to the sort of catastrophic. And so it's something that has to be looked at very carefully. And of course, the other thing I guess to bear in mind is that a lot of children who suffer from cerebral palsy, it's nothing to do with the circumstances of their birth.
No.
Isn't that right?
Yeah, no. Sometimes it's because as they were developing antenatally, as you were saying, there might be placental insufficiency, which leads to the same thing, oxygen deprivation, and that their brain is starved slowly, and so they don't develop as they should have done, and no one's done anything to help them. Yeah, no, absolutely. It's same outcome.
Yes, and of course, sometimes the cause can be genetic, and nothing at all to do with anything that happened during the pregnancy. It was just one of those things that was unavoidable and was always going to happen. But
they can coincide, and that's always really difficult as well.
These can be some of the most difficult cases to get home on, isn't it? In terms of not necessarily the breach of duty. I mean, sometimes that is relatively easy to establish on the basis of the monitoring or lack of and that sort of thing. But linking the breach of duty to the harm can often be the most difficult part of these cases.
Sometimes you can tease things out, but usually you can't. And so we have to rely really on the doctrine of material contribution.
Yes.
Really just a rule that says if a doctor, a clinician has done something wrong and science can't tell you how much of the injury is due to their error and how much would have happened anyway, rather than give you nothing because we don't know what the fair share is, we give it to you all. I mean, it's just a rough and ready way of attempting to do right by people. And we often have to rely on that, but you do still have to show a breach, which would be capable of causing that injury, because, of course, some injuries aren't the typical injury that would be caused by oxygen starvation. They are just related perhaps to some sort of genetic abnormality.
And how do you go about actually assessing the extent of the injury and thinking about how an individual should be or could properly be compensated for that? What sort of things can they claim for?
Well, you claim for everything that you need to put you back into the situation you should have been. So to be an independent person, able to do as much for yourself and do as many things as you should be able to do. So you want accommodation that's suitable for you so you can make use of your home and be at home in your home. You need care so that you can not only be cared for, but go out and do things and access the outside world. And so more and more we also claim for things like assistive technology. So the means of allowing someone who can't themselves access what's around, allowing them to do that. And sometimes that can allow them actually to do work, maybe not remunerated, but something that helps them to be part of the world around them, which is what you really want. It's not a lump sum of money just to be put in a corner and not to do anything. It's for a purpose. And
but that's the thing to bear in mind, isn't it? I mean, the sorts of compensation awards in these cases can be enormous, and it seems like an awful lot of money. But of course, the cost of providing 24-hour care for a severely injured child is enormous, and it's that sort of thing that adds up to the large awards. But the other thing is, I suppose that these days technology can provide, as you say, you touched on this, assistive technology can help people to access the world in a way that their physical disability prevents them.
Yeah, you can.
And things like communication, because obviously communication is a big issue, isn't it? Because some children may have preserved brain function, but because of the muscle dysfunction, aren't able to speak. Or so we have had a number of cases where we've got quite sophisticated communication devices paid for, so that enables people to communicate, which can be sort of life-changing.
And for mobility, to access the outside world. So different types of wheelchairs that can deal with different types of terrain and enable them to take part in activities or do things that maybe their families do. If their families do cross-country biking or something, they can come, the terrain's different. They can join in everything, specially converted vehicles so that they can take their special wheelchairs and everybody with them. So they really can access everything that their family are doing.
And also, I think another important element is things like case management, because I think many families find it incredibly difficult to negotiate, trying to find the right therapies, to find the right assistance, to find the right treatments and that sort of thing. And having most of these awards include the cost of having a case manager, somebody who's experienced in these things, to help you put together a package of care and support and
changing
therapy
over time, because of course people's needs change as they grow and as they get older.
And parents sometimes want to be parents, not just carers. And I think it's really important to try and deal with that in the claim. And actually, the other thing I think one thing that people have worried about is whether or not the money will run out. And I think some reassurance about that is perhaps explaining a little bit about the way that damages are structured or awarded in these sorts of cases.
Reassuring them that what's almost certainly, if you've got an NHS trust as a defendant, almost certainly your child is going to be awarded a lump sum for the majority of the items, but that care and case management, which are a huge part and the part that really matters, once you've got a permanent home that's been specially adapted, then you need the care and case management to continue for life. And so you'll have a lump sum for most things, but then you'll have an annual award, periodical payments paid in December each year, for the year going forward of a set amount, which is index linked, so it goes up each year.
So it will go up as inflation goes up and wages go up. Yeah.
And they can go up the award can go up at stepped changes, maybe when child reaches 19 or 25. And the exact age or ages when you get the step changes will be related to the medical evidence when their needs might change. 19 because of more independence and things. And those awards are large each year. I mean, recently I've had awards in sort of the area of like £370,000 a year for care and case management. And of course, having it annually means that everybody is covered because the child will get the care and case management they need literally for life. It doesn't matter what their life expectancy is.
It's a very good point because, of course, many parents who come to us are very concerned about what will happen when they're no longer around to provide the care for their injured child.
And that's sometimes why their children are older when they come to us, because it's when they started to realise that it's getting difficult lifting, doing everything for them, and they start to worry.
So I suppose one of the things that we ought to talk about is time limits, because obviously in clinical negligence, as a general rule, there is a 3-year time limit from the time of your injury in which to bring a claim. But of course, for children, the time limit is different. That 3 years doesn't run
until their 18th birthday, so they have until they're 21.
Exactly. But of course, for many of these children, I mean, well, first of all, I would say that for most people, it's best not to wait until the last minute to consider bringing a claim. If you are concerned and you think your child suffered an injury because of the way they were delivered, it's best to get advice as quickly as you can. Now, it may well be that the claim can't properly be assessed until the child is older and has developed a little bit more. But certainly getting the evidence in place early is better, isn't it?
Yes, no, absolutely. I mean, you have things you need to be exploring to do with breach of duty and causation before you even get to looking at the child's injury and looking at their prognosis in order to value it. Yeah. And of course, the earlier you come to us, the more likelihood there is that we can, if we get an admission of liability, that we can get you an interim payment, which means that someone can be moving forward with their life, specially adapted accommodation, care and case management, the therapies that are going to help their child to fulfill as much of their potential as is possible.
Exactly. That's the practical benefit of getting the help in place as quickly as you can. And as you say, for a child who has a retained mental capacity, then obviously the 21st birthday is their time limit. But if the child is so severely injured that they are not capable or will never be capable of looking after themselves or making decisions for themselves, then of course the time limit really doesn't run at all. I mean, they have an unlimited time. Although again, it's better to start a claim sooner rather than later.
Yeah, there's absolutely no reason to wait. But if for whatever reason somebody hasn't been to see a solicitor, don't let the fact that more than 3 years have passed put you off. In fact, don't let the fact that your child's over 21, for that matter, put you off. It's worth taking advice. You won't know unless you ask someone.
Absolutely.
And you could be barring yourself or your child really from compensation, which would help them for the rest of their life.
And funding of claims is, well, legal aid is available for children who suffer a neurological injury within 8 weeks of their birth. And but also many of these cases can be dealt with under no win, no fee agreements, again with no risk for the families, so they don't need to be concerned about that.
They don't lose any of their damages at all. They pay, like with every client, they pay absolutely nothing as the case goes along, and at the end of the case they recover everything. So
well, thanks, Tami. I mean, this is a very complicated subject, and I know we could talk about it for
Definitely.
days and days, and I'm sure we'll come back to it in future episodes. But for now, thanks very much for your...
Thank you.